Production funding for Behind the Headlines is made possible in part by the WKNO Production Fund, the WKNO Endowment Fund, and by viewers like you. Thank you.
A look at local efforts to keep vaccination rates high tonight on a special edition of Behind the Headlines. I'm Eric Barnes, publisher of the Memphis Daily News. Thanks for joining us. I'm joined tonight by Dr. Stephen Threlkeld, an infectious disease physician. Thanks for being here.
Good to see you.
Also, Dr. Michael Threlkeld, another infectious disease physician. Thank you for being here.
Thank you.
And we are following up on the special that was just on, a Nova edition on vaccinations. It's available, if people didn't see it, it's available on the web. And let's just start first with your reaction.
I thought it was a fabulous piece. It looked very clearly at the data, and it looked at how emotions can play into both sides of the argument about vaccines. I thought it was very interesting that in addition to looking at the people that were worried about the vaccines, it showed the reaction of people who had lost loved ones as a result of not having that vaccine available to them. And I think that's an important thing to focus on, not just the minuscule risks of the vaccine, but the huge risks of some of the diseases that we seem to have actually forgotten about over the years.
Your thoughts?
Yeah, I agree. I thought it was a very well done piece, one of the best pieces I've seen. It presented both sides of the process fairly and reasonably, but I think still came down on the side of science and what the data actually supports.
Yeah, and let's localize things maybe a little bit, and we'll talk about all the issues and back and forth here, but locally, what is done for people to get vaccines? What is done, people when they talk about Memphis, talk about health issues, they talk about poverty, they talk about access to health care. Your thoughts on people who watch who need more information locally or, don't have the money necessarily, don't have the insurance. Your thoughts on that side of things?
Well, of course, vaccines are available at low or no charge through the health department and other sources for low income situations. But as far as who gets a vaccine, most kids get their vaccine at their pediatricians or their health clinic, wherever they go for their initial care. And there are, of course, restrictions of coming back to school and starting school and so forth, that you have to have certain vaccines in order to do that. So I think we get the vast majority of kids in the community.
Yeah, and your thoughts, part of this came up, the Nova special first played many months ago, but it came back up in part because of the measles outbreak that made the headlines in Disneyland. Have we ever had that sort of, the Disney one is a real big deal, and partly because it's Disney and there were a lot of people involved, but have we had outbreaks, or how often do we have outbreaks locally of measles, mumps, these kind of standard childhood diseases?
Well, over recent years, there have been increasing outbreaks. There have been, since about 2000, at which time the disease was actually eradicated in the U.S. In other words, cases didn't originate here anymore. They had to be brought in from other places. It's still viable out in the world. There had been some epidemics in Eastern Europe, most recently in the Philippines, and so people came here in reasonable numbers, and when they encounter people who've not been vaccinated, that then is the reservoir that can spread from the other countries through pockets of this country where people may have not vaccinated their kids, and that can set off a problem for people who can't be vaccinated. People have impaired immune systems and can't get the vaccine. We have to protect those people, and they then get exposed to people in the community who get it, who shouldn't get it.
I thought it was one of the really interesting things and they showed it visually in the Nova special or the Nova episode, but how I had no idea how contagious measles was. I don't know why. I should know that because I had my shots when I was a kid. My kids had their shots. I don't think about it, but it's remarkable that it could be so contagious.
Yeah, extremely so. When I first started practice here back in the early 90s, shortly after I started, we did have a fairly good-sized outbreak here in Memphis, and there was a campaign of carefully vaccinating anybody that had missed their vaccines, and particularly in the hospitals, we redoubled our efforts to make sure that all the nursing staff and physicians had been appropriately vaccinated, as they might be exposed to cases. But we did have a significant increase of cases during that year.
And not to hold you to the number, but what would be significant?
Well, any cases is significant in a community nowadays, because it should be gone. But we had, in the double digits of cases around the county. So a significant number would be more than one or two cases, because it's so contagious that all you need is one case, and then you may have a lot of secondary cases.
Right. I mean, this you all know this, but and it was to some degree talked about on Nova. But before a vaccine was introduced in 1963, there were 4 million measles cases with 48,000 hospitalizations and 500 deaths every year. So it's amazing to think about I don't know what the flu numbers are, but it would be as common, or would feel to me as common as the flu, I suppose.
We forget about the terror that parents used to think just a couple of generations ago about their kids getting some of these diseases and what the mortality rate was. If you look at the human life expectancy in this country, it's increased dramatically over the last century, but it's not because people are living any longer. You still make it to 100 or so, and that's pretty much it. So our life expectancy has only been increased because people don't die as children anymore, and more people make it to be adults. So a huge impact on that has been, in addition to sanitation and clean water, has been vaccination and preventing a number of these diseases that used to kill thousands and thousands of people as small children.
Yeah, and your thought, I mean, there's a quote here from a state epidemiologist from Mississippi who said, we've become a victim of our success. People don't realize how bad these diseases are. You must face that, I suppose, on some level. And maybe we'll start with that people don't realize.
They don't. I mean, you think of just smallpox. I mean, measles has been eradicated from this country in my lifetime. I was born in 1963, the year the vaccine came out. And we've gone from all those cases to 0 cases originating in the U.S. Smallpox, up to 30% of the people died. I mean, it killed millions of people through the world. The last case ever recorded because of vaccination was in 1977. We no longer vaccinate. Not many people remember smallpox. A lot of people now don't even remember the vaccine because we don't give it anymore. It's not needed. We hope to get there with measles and polio and the other things too.
Right.
But holding back the vaccine actually gets us farther away from that goal. We do see in smallpox a way that we really have eradicated a disease from the face of the earth. And I think people have completely forgotten how horrible some of those diseases are. As Mike said, I mean, that was the terror of childhood. Most people around here may have lost a grandparent or great uncle or aunt, or a great uncle or aunt anyway, during childhood illnesses. And it was very common in that generation.
Well, I remember in high school, an English teacher who had a limp, she had polio. And so, that was something that, even at that time, that was in the, I don't know, 80s or something like that, that I was in high school, it felt like a third world disease to me. I mean, it just did. And we think of these things more and more. And let's go through some of the ones we're talking about with the vaccinations. Again, there's this real focus on measles because of the Disney outbreak. But there's whooping cough, chickenpox, hepatitis, mumps, rubella, polio, and we'll get to HPV in a second, a newer vaccination. When you all, I don't know if you confront or come across people who are resistant to vaccines. Did the things in the Nova episode ring true? I mean, have you confronted patients or people who are sick who said, look, I don't believe in vaccination?
Of all ages, not just parents talking about their kids, but we have, for instance, we try to vaccinate every hospital staff member at every hospital in town for influenza.
Yeah.
And occasionally we have employees that just say, no, I'm not going to have one. And you say, well, why? And they say, well, I don't know, I don't like shots, or I'm afraid of side effects and so forth. So that's true not just of parents and their children, but even adults sometimes that say, well, I heard that can cause the disease, or I heard that can cause bad side effects, and so I don't want one.
You hear about the flu all the time. I mean, that, I don't get a flu shot because years ago I got a flu shot and I got the flu, right? I mean, and does that, I guess that thinking extends for some people to these really horrific
Sure,
diseases.
and something similar to the measles thinking, people will say, well, I don't ever get the flu shot because I've never had the flu. To which I usually respond, well, I've never had a serious traffic accident, but I still wear my seatbelts because it just makes mathematical sense. And the same thing is true for these vaccines.
We talk a little bit about, let me start first with the CDC numbers on the rate of immunization. I'll just do measles, mumps, rubella. This is from 2013. Tennessee is 92%. The overall national rate is around 92%. Tennessee tends to be right in the statistically in line with the rest of the country. Mississippi, just to our south, though, is a state that has a higher rate. And for some people, again, the New York Times wrote an article about them. Other people pointed to them as having kind of a model law. And we've got a quote from the Mississippi, Mary Currier from Mississippi State Department of Health talking about the Mississippi state law, and then we'll listen to that and then we'll talk about it.
What makes Mississippi's vaccine program so effective?
Well, one of the things we have is a very good, strong public health law. Our law for school entry allows for medical exemptions, so no child who shouldn't be vaccinated is vaccinated. But it doesn't allow for philosophical or religious exemptions. One of the reasons for that is in the 1970s, the Supreme Court in Mississippi found religious exemptions to be unconstitutional.
Do you have some numbers for us? Kind of what percentage
Sure.
of children, were being vaccinated compared to now?
Well, I think our best number is that 99.7% of our kids entering school are vaccinated. And that, again, is because we only have medical exemptions. We don't have philosophical or religious exemptions.
What do they normally go to and say why their child should be exempted medically from getting this vaccine?
Mm-hmm. Well, there are several reasons for a medical exemption. The one I think that's very important is children who are immunocompromised. For example, a child who's being treated for cancer or a child who's on high-dose steroids shouldn't be vaccinated with live virus vaccines. So, for example, the MMR, which is the measles, mumps, and rubella vaccine, is a live vaccine. And kids that are immunocompromised should not get that vaccine. If you have everyone who can be vaccinated, then that protects those kids who can't be vaccinated. So that's one of the reasons that you really want all kids who are medically able to be vaccinated to go ahead and get the vaccine.
All right, and I should first thank Mississippi Public Broadcasting for getting that clip for us. I'll just go to you first. Your thoughts on, would you like to see Tennessee have that kind of law? Would you like to see every state have that sort of law?
Yeah, I think we have to realize that kids who are unvaccinated, sitting in the pediatrician's office or in the school next to a kid who cannot be vaccinated because their immune system won't allow them to be, those kids are potential biologic weapons against the poor kids who can't be vaccinated. So there's a real danger to others around you if you are not vaccinated for one of these highly contagious diseases.
And what about the religious objections? Tennessee does have a religious exemption. You can apply and say, look, my religion beliefs, and you can get out of getting your kids vaccinated. Mississippi does not. Thoughts on that?
Well, I can see where that's an issue to someone who has that strong feeling. But again, this is not just an individual choice. It's a choice that affects everybody else as well. We don't allow somebody to have a religious belief that I like to shoot people. If it injures other people, then that's where you end up having to draw the line from my standpoint. And we have other laws that are analogous, like you have to wear your seatbelt or you get a fine or a ticket or whatever. You're not allowed to say, well, I don't like my seatbelt. We know that statistically that saves lives, and we've chosen to make that a law that you have to do that.
And is it also, it's almost like the smoking bans.
Yeah.
I'm old enough to remember when you could fly on a 737 from Chicago to Seattle and there'd be a guy next to you smoking cigarettes, and then they got relegated and it was probably the public health, the public consequences, that it wasn't just your personal choice, it was scientifically proven. Yeah. You're doing bad things to your neighbor. And I guess that same thing is true with
I think the show actually made that quite clear when it showed that the herd immunity requires at least a 95% or so immunity in order to protect everybody else. And as that one child and his parents said, he's depending on everybody else to protect his kid because his kid can't get that vaccine.
Right.
We have to be careful. It's a complex issue, passing laws that violate people's religious principles. But in this case, when it's harmful to others, one can homeschool their child. You don't have to vaccinate your child. You just can't have them in school to be a potential risk to other people. Yeah,
it was interesting. The New York Times had the article that I found that there was an effort in the Mississippi legislature to soften, to put in a religious exemption. And they quoted, going back to the health professionals, they quoted from a nurse who works, I think, in Jackson. It's in the article online, saying, I don't want to be told I can't, I have to do something. So even you've got a medical person who's trained who should understand the benefits of this saying, I don't want to be a part of that. Back to the Nova episode, there a mom who talked about who can I trust? And that sort of sense of, I'm not sure who I trust in this. There's lots of information out there. I'm confused. And I think there's that sort of human thing of wanting to protect your child. And if you become uncertain about what's out there. So for people in Memphis, where do they go? What do they do to become certain about what they should do with their kids?
I think the CDC has some excellent website that has a lot of information about specific vaccines. I think that's a great internet resource with trustworthy and reliable information. I think that's a good place for them to start to read about the diseases.
These days, medicine is changing so much that there's not the firm connection between doctors and patients as much as there used to be. You know, you would hope that your doctor, it's important for healthcare providers to understand the concerns, to listen to them, and to answer the questions based on the facts that we have. One would hope that the physician, doesn't have stock in a vaccine company, that they have no reason to push one viewpoint or another other than the facts involved. And you hope that there's that relationship where a parent can talk to their pediatrician and that the pediatrician will hear their concerns and say, look, these are the reasons that there are occasionally problems, but they're so small compared to the benefit, and really look at facts and hope that, much as the special showed, and the mom who went looking for the facts aggressively, those facts can speak for themselves when they're portrayed correctly.
Right, and for people who may have come in, again, the Nova episode is available online, Vaccines, Calling the Shots. That was the mother who has the autistic child. And that has been one that's gotten maybe too much attention, but the attention's out there, and it takes about 10 seconds on the internet, autism, vaccines, and find sites and doctors who are quoted. But it was interesting, I thought, that she goes on the journey to try to find an answer for this, for autism, for which there is no answer yet. And she comes to the conclusion that it wasn't the vaccines. But have you had people with children with autism who've come to you and said, I don't want to get my kids immunized because of a fear of autism? Do you confront that ever?
I seldom do that because we don't really take care of children in our practice so much.
Sure.
But,
but it's out there.
Oh, surely, yeah.
And it's been brought, all the Hollywood stars, and there's this concentration of unimmunized kids in Malibu of all places, and
yeah, I think the evidence is out there and on the internet. As this woman reviewed things, and I was quite impressed with her review of things, she came to the logical conclusion that there simply is no data to support that at this point.
Yeah.
Kids get autism about the time and the age that they're being vaccinated for some of these things. So it stands to reason that the vaccine and the initiation of autism symptoms are going to be about the same time.
Yeah.
So you can see that there would be a logical thought, and it's worth looking at. It certainly is something that needed to be investigated. And unfortunately, the other view was legitimized by some illegitimate research, which was later shown to be fraudulent.
Right.
But it takes a lot of data to get us away from that.
So I'm in the media, print, and doing the show, and there's this kind of notion of a false equivalency. So that there's someone out there watching this show or watching the Nova special who would say, well, you ought to have somebody who disagrees with these guys on the show, somebody who says there is a link between vaccines and illnesses. Talk about media coverage. Overall, how does the media do in terms of covering vaccines? And they put a lot of effort in since the Disney outbreak. How does the media do?
I think they've done better since this. I think because the media is composed of human beings that also don't see the illnesses anymore. And so I think it's easy to be caught up in some of the emotion when somebody has a reaction to vaccines, and people can get fever and smaller sorts of reactions. Typically, we tend to think of that. Well, I don't want that, but we don't see the illness. But when we do see the illness creeping into home, it's like Ebola. People are clamoring for an Ebola vaccine, right? We don't have one yet. We're beginning to test them. 50 years from now, once Ebola is gone, people may say, "I'm not sure about this," because they won't remember the horror that we're facing now.
Right.
And I think with the measles outbreak in particular, the excitement was over the cases of measles, not over the reaction to the vaccine. So, the media was going to tell about, oh my gosh, we had 17 cases of measles, and people all panicking about that. So in that circumstance, it was probably a backlash in that everybody wanted a vaccine. Because, oh my gosh, I don't want my kid to catch this measles.
Right. Staying on the media for a second, when the Ebola thing, we did a show on Ebola. We tried to keep it calm. We didn't wear gas masks, but we brought in some public health people and just kind of, why people shouldn't really be concerned about Ebola. And the joke kind of in that show was that, well, really people should be just worried about getting a flu shot. Is that kind of, again, this media coverage, does it blow these things out of proportion?
Well, I think sometimes a little bit, just because that's the excitement of it. And obviously that's what people want to hear about and get interested in. They don't want to hear about everything is fine on their evening news. They want to hear about what the latest excitement is.
Yeah.
But I think we lose track of sometimes about the risks of everything we do day to day. We unconsciously perhaps think about that, but for instance, people get up and they take a shower in the morning. not stopping to think that that's perhaps the most dangerous thing they did all day. People slip and fall and break their hips and their necks every day in the shower. Or they drove into work not thinking that they could have been killed. Statistically, driving in probably was a much greater risk than the risk for the flu shot that they got that year.
Right. I've heard, I think, and if I get it wrong, Richard Janikowski, this will seem like a left turn, who is a professor at University of Memphis and criminologist, and talking about how you are more apt to have a serious injury in your bathtub than to be shot or be a victim of a violent crime in Memphis. And yet lots of people are really afraid in the United States, Memphis, wherever, about the violent crime. That's right. I guess, how do you counteract that as doctors? Just the facts? I mean,
I think the facts that the same thing is true for plane crashes. They get all the publicity, but are a minuscule fraction of the people that die in car accidents and other sorts of things. But it just it makes for better press, and I think you combat it. Any sort of media interview that I ever have the opportunity to give, I almost always end with, "Oh, but by the way, get your flu shot," because that's a lot more important than any of the things that we're talking about previously.
Yeah. We talked a little bit about, some of the, I don't know, for my layman's terms, traditional vaccines. There's a newer vaccine that more people are getting, younger people are getting, which is HPV, and that was talked about in the Nova episode. Your thoughts on, we talked a little before the show. Again, it took me a few minutes to go, vaccines, HPV, and there's a website out there that talks about this connection between HPV and illnesses. First, why don't we go and talk, because people probably aren't as familiar with that. What is HPV? If they didn't watch the episode, the Nova episode, I'll turn to you.
Well, it's a very common sexually transmitted disease generally, and it causes a number of serious problems, not the least of which is cervical cancer, which is a killer of thousands upon thousands of people in the United States. And so, when you think about the concept of coming out with a vaccine that is safe, effective, and prevents cancer effectively, sounds good. And that's what this vaccine really does, and the numbers show that it do.
And when did that vaccine start? 2006, I think, something like that.
About 6 or 7. Yeah.
Is that? How do I want to frame this question? I think medicine does make mistakes, right? I mean, you watch late night TV and there are a million medical device lawsuits that are going on because people got whatever they got. I shouldn't say what they are. Your response to that this medicine is not perfect. Right? there can be mistakes made with medicines, with medical devices, and so on. Is that where the fear comes from, and how do you tell people just calm down?
Everything we do in medicine, and really everything we do in our lives, is a risk-benefit analysis.
Yeah.
And so all we can do is look at the facts as we have them and show that, for example, in measles, thousands of people are dying of measles, and now practically nobody dies of measles. Well, that was a huge benefit with no particular downside that we can see. For HPV, the vaccine has been tested in thousands and thousands of cases, or preclinical trials. There's never been any signs of any obvious side effects. Can everybody be certain that there would never be a side effect? Of course not. But we do know that year in, year out, thousands of people are dying of cancer. And this vaccine seems to effectively prevent one of the major causes of cervical cancer. So I think looking at the facts, logically, one would have to say, gosh, no downside that we can see, huge upside.
Right.
And that's a decision that I would choose to make for my kids.
I thought it was really interesting, and I may get the numbers wrong, but the man whose son got polio from the oral polio vaccine. And that was just so tragic. And you could see that person, you can imagine as a father, we talked before the show, we're all fathers, being so angry. And yet he was a little bit scientific about it, that look, at least we got this changed. We went from one that, even though I think it was 1 in 2.4 million cases or something, when people took the oral polio, they could get polio from it, and they switched to the injectable. I guess that's still in your math equation.
Yeah,
we're still way, way ahead.
It's a tragic thing when it happens to an individual like that, and now the newer vaccines are more potent and effective with a killed virus that can't cause that. But at the time, the inactivated was not nearly as effective as the live one, and the oral had the benefit of potentially vaccinating other kids in the family because they actually catch the vaccine virus from others. So when the population was poorly immunized, that live oral vaccine saved countless thousands of people from being paralyzed, versus this one individual, tragic as it is, the benefit statistically overall to society and to countless people at large would favor giving that vaccine.
Yeah.
Well, it's just another way that, I mean, you know, when we look at the risk benefit, when the disease goes away and all of a sudden the vaccine does in fact have a higher side effect than the incidence of the disease locally, that's a victim of success, right? So that's the time to
Right.
rethink that vaccine, either eliminating it or so forth, which is what they did with the vaccine. And I thought that father had an amazing kind of attitude. We're a long way away from that with HPV infection. People are dying by the thousands and thousands
Yeah.
of that problem. So an important fact to remember as a vaccine develops and more people get it, but a long way from that in this particular instance, I think.
Another, and I've forgotten if it was mentioned in the show, but again, you go out there, you hear parents who have concerns about so many shots at child. That is an objection or a concern, and that the number of shots your child might get is up to, I can't remember how many at this point, you might know, but is the data really settled on that in terms of the number of shots you're going to get as a child?
Part of it is that there are those vaccines for those serious illnesses, and some of them need to be split up into several different doses. And the way the vaccines are given is a way to try to combine those shots at times of appropriate visits so that people aren't coming in at all different months to their pediatrician. So part of that's been sort of bunched together for convenience of giving them. There
Right.
doesn't seem to be any downside of giving most of them at the same time as far as people can tell. And yes, they could be split up, but then you'd go, 10 different visits to the clinic or the
Right.
pediatrician, which would be inconvenient and more expensive.
Right. Just 30 seconds left in the show. We'll come back to the flu shot. The flu shot was a bit of a miss this year, but that's not a reason not to get a flu shot.
No, it's always variable. You're still better off to have gotten it than not, but they have to change it every year to keep up with the changing virus. So some years are better, some years worse, but almost always, and say always, best to get it.
All right. Thank you both for being here. I appreciate it. Thank you for joining us. If you didn't see the full special, it's on the PBS website. Thanks. Good night.